Okay, next up is the hypoglossal nerve, and that is this one right here, and the same on the other side, right here. The hypoglossal nerve is responsible for our ability to move our tongue from side to side. So to test if her hypoglossal nerve is working, I'm going to have Rhea stick out her tongue and move it side to side. Can you do that? Very good. So because she was able to stick out her tongue and move it side to side, that means her hypoglossal nerve is functioning properly because it controls our ability to move our tongue from side to side. Next is the accessory nerve, and that is this one at the bottom here. And it's the same on the other side. That's the accessory nerve. This one here. So the accessory nerve is responsible for our ability to shake our head side to side and then also elevate our shoulders. So to do that, I'm going to have Rhea do the exact same things. All right, first, can you shake your head side to side? Now can you shrug your shoulders? All right, because she was able to do both of those things, that means her accessory nerve is working because the accessory nerve is in control of our ability to shake your head from side to side as well as shrug your shoulders. Next, we are doing the vagus nerve, and that's this one in the middle here. Right there, and then on the other side, this one right here. This is the vagus nerve. On the other side. The vagus nerve is responsible for our ability to swallow. So to test that, I'm going to have Rhea take a swig of this water and see if she can swallow it. Go ahead. All right, and she was able to do that successfully. So that means her vagus nerve is operating correctly because she was able to swallow the glass of water, and the vagus nerve is in control of our ability to swallow. Next is the glossopharyngeal nerve, and that's this one here, and then also over here, the glossopharyngeal nerve. Side. So this nerve is in control of the taste buds, the sensory taste buds in the back of the tongue. So to do that, I'm going to have Rhea, close your eyes. I'm going to have Rhea see if she can identify what flavor this is. So I'm going to just be putting a drop of it on the back of her tongue and seeing if she can identify the taste. And what flavor is that?
Strawberry milk.
Strawberry milk, that is correct. So because she was able to correctly identify the flavor, that means her glossopharyngeal nerve is working because the glossopharyngeal nerve is in control of the sensory function of the taste buds in the back of the tongue. Next is the vestibulocochlear nerve, this one here, and then on the other side, right here, the vestibulocochlear nerve. On the other side. So the vestibulocochlear nerve is responsible for our sense of hearing. So to test that, I'm going to have Rhea tell me the furthest distance that she can hear the sound of this ticking stopwatch. All right, so can you hear it now?
Yes.
How about now?
Yes.
And then how about now?
No.
Okay. So because she was still able to hear it when it was relatively close, Rhea's vestibulocochlear nerve is working because the vestibulocochlear nerve is responsible for our sense of hearing. Next, we will be testing the facial nerves, which are these two right here, and then the same on the other side. So to do this, it has a sensory and a motor function. So to test the motor function, I'm going to ask Rhea to smile because the facial nerve controls the muscles in the mouth. So can you smile for me? And yes, she did. So that means that the motor part of the facial nerve is functioning because she was able to smile, and the motor nerve controls the muscles in the mouth that allow for mouth movement. Now, to test the sensory part of the facial nerve, you need to close your eyes. I'm going to be putting a drop of this onto her tongue, and if she can correctly identify what the taste is, that means her facial nerve sensory function will be working because it controls the taste buds in the front part of the tongue. All right, open your mouth a little bit. All right, now what was that?
strawberry milk.
It was strawberry milk. So that means that because she guessed it correctly, because she was able to identify the taste, that means the sensory part of her facial nerve is functioning because the facial nerve is in control of the taste buds in the front part of the tongue. For the next test, we'll be testing the trigeminal nerves, which are these two here, and then the same on the other side, these two. So this nerve has two functions. It has a motor function, which Rhea is going to demonstrate, is going to test by closing her jaw, which she can do. So that means the motor part of the trigeminal nerve is functioning because that is what controls jaw movement. There also has a sensory portion, which I'll be testing by using this Q-tip to test whether she can feel it on various parts of her faces because it controls the sensory neurons in the face. So you can close your eyes. Do you feel that?
Yes.
Yeah. You feel that?
Yes.
All right. So because she was able to identify and feel the Q-tip on her face, that means her trigeminal nerve is functioning, and both its motor and its sensory function. In this test, we are going to be testing the trochlear nerve, which is this one here, and then the abducens nerve, which is right here. To do so, we are going to be testing Rhea's eye movement, since the trochlear nerve controls up and down movement of the eye, and the abducens nerve controls sideways movement of the eye. So if you just look at the middle of the finger, get your head still, up and down, good. And then to test so that was the trochlear nerve. To test the abducens nerve, we're going to move side to side. All right. So since she tested positive and she was able to move her eyes up and down and side to side, that means her trochlear nerve and abducens nerve are both functioning since they control eye movement. All right. Next, we are going to test the oculomotor nerves, which are these right here. And to do that, we'll be seeing if Rhea's eyes dilate when a bright light is shown into them. So, just look up. All right, so because her pupils dilated and constricted, that means her oculomotor nerve is working because that is the nerve that controls pupil dilation and constriction. In this test, we will be testing the optic nerve, which is this one right here. And we'll do that by having Rhea read off this chart, since the optic nerve is responsible for our sense of sight. So if you could cover one eye and then read this line.
FDPLTCEO.
All right, and the other eye?
FDPLTCEO.
That's good. So because she was able to identify all the letters in the lowest line, her optic nerve is working. In this first test, we'll be testing the olfactory nerve, which is this one up here. To do that, we will be testing Rhea's sense of smell. So she's going to sniff this container and try to guess the smell. Close your eyes. Sniff.
Is it garlic?
It is garlic. So because she was able to correctly identify the scent, that means her olfactory nerve is working.